Hello everyone, Sports News. This time I was going to talk about health, which is kind of a big deal right now, especially because we've got a global pandemic going on. But funnily enough, health is one of the things that people are not really talking about at the moment, which is weird because we're having a global pandemic at the moment. So it seems like health should kind of be one of the first things people are talking about. But in the media, especially, and like world leaders and community leaders and stuff, I've actually kind of seen fuck all talked about in terms of health, which is weird. And it also made me think that people actually don't really talk about health that much in general. There's a lot of talk at the moment about hygiene and doctors and medicine and vaccines, none of which are really health itself. You know, like maybe they connect to health, maybe they bear on health a little bit. But like I haven't seen anyone really talking about the need for health in a personal and collective sense. Like one of the first things I thought in terms of the pandemic, and that kind of kept growing as it went on and as it kind of got more serious and shit and started to reach into New Zealand and shit, was that if people were more healthy in general, like if the average was a bit higher level of health, then it would not even be such a crisis, you know, for there to be a new virus that we don't know how to deal with. Because, I mean, like if a higher percentage of people were at a higher level of health, then it wouldn't be a question of how to deal with it because our bodies would deal with it. But that's not something that's really built into the social structure. I mean, there are kind of messages about health, but they're pretty shallow, really. Like, do 30 minutes of exercise once a day or once a week or whatever, kind of any exercise. I mean, it's better than nothing. And, like, eat vegetables and shit. But, like, it really doesn't get to the point or the depth of, like, what health is really about. Like, there's no kind of, like... I mean, there are messages about it, but I don't think they are sufficient for what people actually need to live a healthy and fulfilled life or whatever. And I kind of, part of why I feel that way is that I didn't used to be healthy at all, and like I had some times of like quite bad health, pretty much of my own doing really, because I wasn't eating well and I wasn't exercising and I was putting shit in my body that was not good for it. And then I hit a point where I probably couldn't handle that anymore, and then I decided to become healthy or whatever. And as I've gone further and further down in that direction, I've realized how healthy you can actually be, and that's like kind of off the charts in terms of what people call healthy in the kind of general social sense. I mean, personally, I think like health is kind of at the core of everything. Like if you don't have it, then you're not really going to be able to do much else either. Like you probably be able to, I mean, you can maintain your life maybe, but like it's not like one thing in your life amongst other things. It's the main thing, and the other things are kind of orbit around that or whatever. But I mean, it's kind of like treated as, yeah, like an auxiliary to life, and like something like an interest that you can be into or not. And even then, like, I mean, like a lot of people were into the gym and fitness and shit, but that is not really health either, it's fitness. Like, there's not like a holistic image of health that's readily available or promoted to everyone. And that's weird. Like, what is more important than that? Like, there's so many more things that are given priority over that, even though we don't need them. And like, even in like a global health crisis, where millions, hundreds of thousands of people are dying, people are talking about money and like hygiene and shit, which is kind of like, okay, maybe those things are at risk or whatever, but like, they're not at the core of the issue, really. And those things can't replace health either. Like, you can't just have more money and then you'll be more healthy or whatever, even though it might be easier to live a healthy lifestyle if you have more, you know, access to better food and like more time to spend on it or whatever. But like, I mean, any everyday peasant should be able to get the nutrients they need or whatever, and like do some kind of like health practice or whatever. It doesn't actually take a huge amount of time, and it doesn't actually take a huge amount of effort or knowledge, but like, you just have to do it and know how to do it. And there is a knowledge factor there, but like, I mean, it wouldn't be hard to spread that knowledge and make that the focus of health within a society from the top down, if that was like made a goal, you know, by the government or whatever. But it isn't, which is weird. I mean, like, even like at a time when like most people are at home, you know, here for at least 4 weeks, and some people for probably a bunch longer. Like, why is there not a message being like, you should do extra exercise and do these kind of exercises while you're at home? It's like personal choice and lifestyle and identity has become more important than health, which is like, I don't know, something that can be broadly orchestrated without needing too much specific direction for different kinds of people, you know, like things like yoga and tai chi and meditation are accessible and useful and practicable for the overwhelming majority of people to whatever extent. So like, there's no real barrier there for people, except that there's all this other stuff in the way, as if any of those other things could be more important than health or whatever. I mean, like, the other things are so much in the way that like, you can't, it's an effort to get food that is not treated with chemicals, which is pretty bizarre. I mean, like, it's illegal to steal someone's money. It's illegal to like use someone's, like, the spores of someone's crops that they've copyrighted, but it's not illegal to put poison on the food that you're growing and then sell it to people. Like, that is pretty backwards. Like, I don't know who could really say that that's not backwards. But then, like, people get upset that people are dying, and it's like, well, why do you think they're dying? Like, the whole social structure is almost like geared around people dying. Like, so far is the extent that things are not oriented around health and well-being and balance, that it may as well be centered around death. Like, I mean, explicitly, like, money is put over health and people being alive and having the like basic conditions to be alive and healthy, from like the perspective of the government and the law and the institutions that have the most bearing on the structure of society and shit. I mean, like, this is kind of, there's a lot of time right now for a lot of people to change direction on that, and I have seen like a lot of people doing exercise, you know, like on their walks or having a run, and it seems like more people are doing that than usual, which is good. But it should be like the main focus of what people are doing, and like the other activities of life should be oriented around that. Like, people put a huge amount of energy into work, and a lot of the work is not very useful, and a lot of the processes are not good for the bodies of the people who are doing it, and they're not that good for the bodies of people who it impacts on, and blah blah blah. Even in like instances where that is partly kept in mind or whatever, but like, what is the point in doing a 40-hour week, sitting in an office, or doing anything 48 hours a week, and fucking up your body so that you can have the money to live? It's like who is it good for if the population is not healthy? And like, how are we going to achieve real progress and productivity if like the population is not healthy? Like, that is the real productivity. If we're like generating or maintaining like enough energy in our bodies to actually be a society. But at this point, we're just kind of like pouring energy down the drain in order to produce results for things that don't ever really feed back into that loop of life. So, I mean, maybe it is kind of a death cult. But I think health is something that we kind of maintain collectively too, and it's all well for, you know, each of us to be healthy and, you know, practice meditation and have some kind of health practice. But I think it's a lot more effective for that to be shared and for everyone to kind of like, I mean, as many people as possible to do it together and do it in support of each other. You know, like the people who I know who have a health practice, I mean, like, yeah, the people who are closest to me all have like their own health practice and they're different from mine, but we're all kind of like sharing what our progress is and what we're doing and like what's good and challenging about it and blah blah blah, and that's like a really healthy and useful thing, and it's kind of like giving each other motivation as well. But of what we have in terms of like a public health message, I mean, like, I didn't grow up with any information really about my like organs or my hormones and how they relate to each other and how the things that I do bear on that, like, you know, how eating different kinds of foods would have different effects on your body, and then you'll be producing different chemicals and different hormones that basically are your physical and mental health. Like, what do people really think health is? Like, it's just like an abstract term that's thrown around now. But like, I mean, like, I've been kind of working at it for at least 5 years now, and I'm like kind of just starting to get a handle on what that means to me in a personal sense and in terms of the experience that I'm having with my health practice. But I mean, like, I only just really realized that like my energy levels and my emotional stuff is all hormonal. Or, you know, like the different like I don't know, chemicals that I'm producing from doing different activities like my job and stuff, and my food and like qigong and whatever, and my attitude too. Like, they all have like a physical existence in like hormonal activity as well, and that, like, you know, the different organs in your body produce different hormones, and you need to be able to balance them and blah 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 blah. Like, why were we learning like this abstract shit at school if we hadn't gotten that kind of extremely essential and fundamental shit down first. Like, I mean, not everyone needs to have all the details of that, but like, people need to have a basic working knowledge of what their body actually is and how it responds to the environment and how they interact with each other and what health means in terms of those things. Like, we kind of just lack a system of knowledge for that. Like, science is like extremely complicated and there are so many different units for expressing, you know, the movements of different things in the world, like materials and chemicals and blah blah blah. But you know, like in Chinese medicine, there are complicated things going on, but it all comes down to like really simple categorizations that you can start to understand as well, and like, you know, file off different things into, and everything in the body and in the world relates back to those basic categories. But I feel like we don't really have anything like that. Like, if you're going to try and get into nutrition and shit from a scientific point of view, there's just like 20 billion different minerals and vitamins and whatever different things you can be putting into your body, and I'm sure that they do all add up if you add them all up, but like how difficult is it to really like access that? And like, how many people are really going to try if they like saw a list of all the things you're trying to get in your diet or whatever? Not that it's bad to have those categories and like those classifications there, but like, it's good to have this simple stuff there to bridge into that as well, so that you can at least have a basic working knowledge of your kind of like diet and activity, and have a basic approach to balancing that. Because I think that like health is something that we're all also individually responsible for, and it's kind of like my responsibility to be healthy, to be able to be as balanced as possible for the benefit of like the people around me and my community and shit, you know, to be able to do as much as possible for other people as much as for yourself. So it's kind of like we need to engage on a collective level and a personal level as much as possible, so that we're not so vulnerable for like crises like this as well. Because like, who knows when the next thing's gonna pop up or what it's gonna be. Like, it's not far-fetched at all to think that a worse virus might pop up now that Corona has cropped up. Like, we didn't think that that was gonna happen necessarily, and then it was like, oh, like the whole world's shut down for months at least, like, and like, who knows whether, you know, Corona might still be going on when the next thing pops up or whatever. Or it might not be a virus, it could be something that challenges us from a different angle or whatever. And unless we have the kind of like physical and mental durability or preparation or whatever to kind of deal with that, we're pretty much exposed to everything that we haven't specifically thought of. Like, what's the vaccine for coronavirus going to do for us if a different virus comes along that we're then completely floored by? Finished.